Raskin for 5 minutes.
Mr. Chairman, thank you for calling this very important hearing. This is a big issue in the state of Maryland. The African Americans make up 32% of our population, but are 39% of coronavirus deaths. So that's around 25% higher than would be indicated just by virtue of representation in the population. But conversely, African Americans receiving the coronavirus vaccine are 16% of the total. So that's half of what you would expect, 50% of what you would expect from African American representation in the population generally. So, and we've heard many of the reasons why communities of color and immigrant communities and rural communities and low-income communities are not able to access the vaccine at the proper rates. And I appreciate very much Dr. Gale's points about strengthening the public health and the vaccine infrastructure generally for the underserved populations. But I'm also concerned that some people are choosing not to get vaccinated because of dangerous misinformation and propaganda about the coronavirus vaccine or vaccines in general. Many immigrant families, for example, rely on social media platforms like Facebook to stay in touch with their friends and their relatives, both here and abroad. And we know that that's where a lot of dangerous information and conspiracy theories thrive. According to the Washington Post, a recent analysis found that social media companies are far less likely to flag misleading posts or videos that are in Spanish than they are in English. And I think that the figure, if I'm recalling properly, was that 20% of dubious Spanish language posts get warnings compared to 70% of dubious English language posts. Mr. Miranda, I'm wondering whether you're seeing misinformation and disinformation spread in the communities you work with, and what are you all doing to address it? What are the countermeasures that are indicated in a situation like that? And how can the administration and Congress help to get the right information about the coronavirus out to the relevant communities?
Thank you so much, Congressman, for the question. I will go even farther. It is the same. It's a very accurate situation that is happening in our community, and I will go as far as to tell you that there is now fraudulent targets on our community, especially the Spanish language senior population has been targeted on trying to get their information and also money in order to get the chance of getting a vaccine. For us, once again, our solution to all of this is to continue investing and making the nonprofit organizations that work in community that have the cultural, bilingual, bicultural experience and that are inside of community, that employ people from the community, that has those health navigators used in other initiatives, or the ACA navigators, or we're talking about the census workers. All of these organizations that are right now so under-resourced and that are providing extra services to those populations, they are the best messenger and they stand ready, and they just need better resources to actually be able to do micro and micro campaigns in their communities with their trusted Congresswoman Waters mentioned about who are those trusted spokespeople. But all of this has to be in combination, and it has to be done in community. It cannot be coming from outside or from mega sites or translations that have been done, informational materials that have been done on without the proper target on the very diverse Spanish language community coming from different countries. So absolutely.
Thank you very much. And Ms. Echohawk, I'm wondering whether you would illuminate the same question from your perspective about the intertwined problems of vaccine misinformation and vaccine hesitancy in the population you serve versus what are the effective educational efforts we can engage in.
Yeah, so the Urban Indian Health Institute, which I direct, published recently, several weeks ago, the very first national survey on perceptions, attitudes, and hesitancy on vaccine, the COVID vaccine across the nation. So why a tiny nonprofit? Because nobody else had done it. And unfortunately, I had to do that with a small amount of funds, and it didn't reach as far as I would like, but it gives us a snapshot. Right now, all of these vaccine campaigns are being conducted on a national level without our voices and without the investment in those who can reach into the Native communities, into Hispanic, Latinx communities, African American communities who know best. So we did it. And what we found is that Native people are afraid. They're afraid they don't trust the CDC, the NIH, as a result of things that happened in the previous administration that eroded the public trust in these public health institutions and research institutions. They're afraid they're getting tested on like we have been done in the past. However, hesitancy and willingness to get vaccinated are not mutually exclusive. So we actually found that Native communities were more likely to get vaccinated in our study as compared to the rest of the country. 75% of them were willing to get vaccinated if they received more information. And so we used our study, we created materials, the first of its kind in the country, using the science, using the data, the limited data that we had, including trusted messengers. Representative Deb Haaland was the #1 messenger people wanted to see get vaccinated. Representation matters. It's why we're all so excited about her nomination to the Department of Interior. Those things matter, and so we're using that information. Without it, so prior to our survey, after it was launched, I received inquiries from federal agencies to contractors who received federal money. They wanted my data because they had been given the contracts to do these public health campaigns and they didn't have the information. So instead, they wanted to take what little I had, take the economic investment coming from Congress and use it for their benefit versus investing in our communities. So those resources need to flow to us, and it's our voices that have to be shaping these interventions.
Thank you. I yield back, Mr.